Assalamualaikum. Another video station. This is orbital cellulitis. So in the video I can say a 7 years old child in hospital settings who looks well alert following the command. He is receiving medication via on the dorsum of his left hand, and eye movement shows there is a left eye swelling, proptosis, and painful eye movement with diplopia. So my differential diagnosis: orbital cellulitis, periorbital cellulitis following trauma, sting bite, retinoblastoma, leukemia. And what history, additional history, onset, duration, progression of this disease. Is there any history of sinusitis, dental infection, and upper respiratory tract infection? Any history of fever, weight loss, daily activity, any headache, confusion, any history of trauma or recent surgery, vaccination history, and any bleeding from any site, and any vision color changes, vision change, especially the color vision. Is there any history of immune suppressive condition or diabetes mellitus? And what examination: airway, breathing, circulation, vital sign, and eye examination for eye movement, pupillary examination, fundoscopy, color vision, ENT examination, neurological examination, cranial nerve examination, and fundoscopy. And what investigation: eye swab if pus is present for culture sensitivity, full blood count, blood culture if needed, and CT scan if there is orbital involvement is suspected, if there is neurological sign, if there is any eye can't be open, and deterioration despite of the treatment. When we consider the MRI, if in the CT scan we have the suspicions that intracranial involvement is present, then we will consider the MRI. So how do you manage it? Orbital cellulitis is an emergency, so we have to admit the child, involve our consultant, neurologist and ophthalmologist, start treatment with IV ceftriaxone or cefotaxime. If the child is toxic, so we add clindamycin. Whenever the child is stable, switch to oral coamoxiclav. And if there is only the orbital involvement, so 21 days. If bone involvement is present, then 6 weeks. This is the acute management, and in long term management, follow up, and we will tell the patient when to come back, and will tell regarding the red flag sign. So what are the complication of orbital cellulitis? So eye complication will be orbital abscess, visual loss, CNS complication, intracranial abscess, meningitis, and inguinal septicemia. At the same time, another video station may be the preseptal or periorbital cellulitis. Periorbital cellulitis, in the description we can say that the same thing, but in the local examination there is erythematous swelling on the upper and the lower eyelid, and there is no painful eye movement. Eye movement is normal. What is the difference between the orbital and the periorbital cellulitis? In case of periorbital cellulitis, eye can be examined, and facial erythema and tenderness is present, but the painful ophthalmoplegia is absent. Normal eye movement, normal vision, and it occurs sometimes preceding superficial trauma. Eye pain may present and periorbital swelling, and there may be fever. but in case of orbital cellulitis, unable to examine eye, painful eye movement, orbital pain, visual impairment, and it may occur preceding sinusitis, proptosis, chemosis, fundus abnormality, decreased GCS, and systemically unwell. And how to manage if it is preseptal cellulitis. So if there is only one uh, upper lid or one lid is involved, so oral coamoxiclav, and we have to review the eye movement and color vision twice daily. If there is both eyelid is involved, upper and both eyelid, and or the severe condition and not improving after 48 hours, so we will give here IV coamoxiclav. And whenever the symptoms is improving, we will switch to oral coamoxiclav. And if penicillin allergy, we will give the clindamycin. Total duration of treatment here including IV is 14 days. Thank you.